So the synovial one, which is the most widely form of joint, so this found at the hip, the knee, the elbow, the shoulder, all of the fingers and all of the toes and the joint and the jaw. So it contains around the joint capsule, within it there is a slippery proteoglycan secretion by the fibroblasts, and this functions within the synovial fluid to provide lubrication for the joint, nutrition distribution, and also shock absorption. So this is a diagram of just not any particular synovial joint, just showing you the components of all synovial joints. So you can see here that we've got two bone ends where they are joined together. So the bone ends, when they join together, are covered by what is called articular cartilage. So this articular cartilage is pearlish and shiny and helps prevent friction movement. As we get older, or if we've had an injury though, that articular cartilage can be worn away. And some of our patients who present for total joint replacement have been tolerating so much pain that they've actually removed all of their articular cartilage, and they've just got bleeding bone on bleeding bone every time they move, which is why they're in so much pain. Next to the articular cartilage, we have what is called the synovial membrane. So this synovial membrane lines all of the joint and is where that lubricant is secreted from. The outside of the joint, we have the fibrous, tough joint capsule. So this protects the joint and allows the joint to move, but protecting it from injury. When we look at synovial joints, besides those key bits we've just seen on the diagram, there are also cartilages, fat pads, ligaments, tendons, and bursas. So it's important for you to remember that ligaments join bones to bones. So from one bone to another, you get a ligament. Tendons join the end of muscles to bones. Just say that again because it's important for you to remember. Ligaments join bones to bones, and tendons join muscles to bones. Factors that stabilize this synovial joint to prevent injury by limiting the range of motion. So we have the collagen fibers, the firm joint capsule, and the ligaments joining bones to bone, the articulating surfaces and the extra cartilage in the form of meniscus, other bones and fat and muscles that help protect it, and then you've got tendons of articulating bones. So where you've got muscles that are joining over a joint, which allows movement. So here we've got a sagittal section, so a side through cut section. So if you were standing on the side and you took a cut through section, sagittal midsection of the knee joint. So what we're looking at there is the skin. If we move from the outside in, we've got that sort of pale orange layer, which is the skin. We have the yellow layer with all of what looks like little lobules in it. That is the fat layer. We've got a blue line, which is the nutrient vein, and then another red line next to it. Remember we said that veins and arteries travel together, so it's a nutrient artery. And then we move towards the center of the diagram where we're looking at the articulation of the femur, the top bone, with the tibia, as well as the articulation of the femur with the patella. If we look at the quadriceps tendon, you can see that that is one of the heads of the quadricep muscles of the thigh, and that quadricep tendon actually encapsulates the patella and then moves down and joins on to the tibia at the tibial tuberosity. You can see that besides both the articulating surfaces of the femur and the tibia, there are additional meniscus or pieces of cartilage that help provide limitation in movement. And then right in the center of it, you've got what's called the intracapsular ligament, which helps keep the bones together.